Fat transfer is taking fat from one part of the body and putting it somewhere else. And it's something that's been available for many years. We've all been doing it probably for 20, I've certainly been doing it for 25 years. But it's become popular recently, and it's become popular because it's become much better. There's much, much better results. The techniques have been worked out. The fat that is transferred is used a lot in the face. So it's going to be used in the cheeks to make the cheeks look fuller, the lips, to fill out the lips, to fill up the furrows of the nasolabial furrows just above the lips, between the lips and the cheek. That's another big area. And also around the eye, the sunken eyes can be treated. So that's the face that we would treat, but we treat really any other part of the body. And another big area is the breasts when they're being reconstructed after mastectomy for cancer. When we're doing fat transfers, the first thing we need to do is to mark up beforehand exactly which areas we're going to treat. And this is something we would do with the patient in front of a mirror, take a photograph, and so that when we come to do it, we know where we're going to put it and where we're going to take the fat from. The procedure's done under local anaesthetic most of the time. If it's a lot of areas, then we would certainly give a general anaesthetic. If we're using small areas, we're usually taking the fat with a syringe rather than a syringe suction, so it's just the suction of a syringe rather than from a machine. And we take the fat and then it's processed. It's processed usually by centrifuge. We put the fat in a centrifuge, we take off the oil and the fluid and any blood, so we've just got pure globules of fat of very small size. We use a small tube to extract the fat so that the amount of the fat globules are very small, and we then reinsert them with another syringe. This is in small quantities, probably 1 millilitre at a time, into the area. But to put in this fat, it's not just a question of injecting it, we have to put it in drop by drop. It's not a quick procedure. Usually it's more like 2 hours or 3 hours. The process of putting in the fat does cause some bruising and swelling, and so certain areas of the body swell very readily. So if you're putting the fat into the lips, for instance, the lips will become very swollen and maybe remain swollen to some degree for a couple of weeks. There generally aren't any visible scars after the procedure because the cannula that we use are very small, and they're so small they really don't show. The results of fat transfer are generally very good these days. In the face, one expects about 75% of the fat to survive. Elsewhere in the body, it's not so good. It may be half, maybe less. So if one's having fat transfer, it may well be part of 1, 2 or 3 procedures. The fat, once it's taken, lasts. There's no reason to think it'll disappear. This is, of course, in contrast to any filler that one uses, which generally dissolves away. So it is a permanent transfer.